Hello, I'm Gianpaolo Flores from Florence Organics. Today we'll discuss a very topical issue. Does vitamin C help treat coronavirus or not? As we all know, the spread of the SARS-CoV-2 pandemic between 2019 and 2020 caused a massive loss of human lives across all continents. The so-called Covid-19 has radically changed our habits and our way of life, marking a time before and after the appearance of the virus. Since then, in different countries worldwide, doctors and scientists have been fully engaged in developing treatments and an effective vaccine to try to defeat or at least limit the epidemic. Among the many attempts at finding a solution to this problem, research institutes are also exploring the use of remedies already known to treat other diseases. One such remedy is vitamin C. In this video, I will analyze the pros and cons of using vitamin C as a cure for COVID-19. In doing so, I will also examine the latest available research. Does the scientific community confirm this theory? Vitamins are essential elements, and taking them in sufficient quantities is necessary for our bodies to function properly. But is it actually beneficial against the coronavirus? The news that vitamin C protects against COVID-19 infection has generated a remarkable response in both social networks and the web. This debate has led the scientific community to intervene. In fact, experts have spoken through official media, and literature on the subject has been enriched with both scientific and educational articles. According to the experts, there is no clear proof that vitamin C can cure novel coronavirus. In fact, so far, there is no cure, vaccine, or drug guaranteed to fight this virus. Despite this fact, theories about miraculous cures that should be effective against SARS-CoV-2 has spread rapidly. However, some researchers believe that vitamin C can help support drug therapy in severe inflammatory cases. Let's look at its properties. Some properties of vitamin C. Vitamin C, also known as ascorbic acid, became popular as a supernutrient that stimulates the immune system after Nobel laureate Linus Pauling divulged the benefits of the substance in a series of books in the 1970s. It has been studied for years, and it is well known that it is an important cofactor involved in the formation of blood vessels, cartilage, muscles, and collagen in the bones. It is also vital in optimizing our body's healing process. Vitamin C is known for its antioxidant properties because it can fight dangerous free radicals, like the so-called reactive oxygen species. In this way, it protects our body's cells and tissues from eventual oxidative damage and many dysfunctions. Vitamin C has numerous and important functions inside of our bodies, many of which are known to support immune function. In fact, during an infection, vitamin C levels can become depleted. At the same time, the body's vitamin C requirement increases with the severity of the infection. In more severe cases, this may require intravenous administration of large doses of vitamin C in order to reach levels high enough to ensure that the body's needs are met. A possible benefit attributed to vitamin C is the reduction of endothelial dysfunction. Put simply, the endothelium in biology is the tissue that covers the inner surface of blood vessels. Other benefits of vitamin C include managing hypertension, reducing the risk of cardiovascular diseases and preventing strokes, certain types of cancer, diabetes, and gout. Pro: Vitamin C cures COVID-19 real research. The study examined 252 Chinese students affected by COVID-19. Trials began on February 14, 2020, and are expected to be completed by September 30, 2020. According to Dr. Zhang Pen, head researcher of the study, head of the hospital at Wuhan University, and director of the intensive care unit at Zhongnan Hospital, vitamin C has a repairing effect through its properties as an antioxidant. In other words, when there is an excessive inflammatory response to an infection, sepsis, the cytokines, the proteins fundamental for the immune system, activate the white blood cells, called neutrophils, that accumulate in the lungs, destroying the alveolar capillaries. The first clinical studies of this research demonstrated that vitamin C can effectively prevent this process. Moreover, vitamin C can help eliminate the alveolar fluid, preventing the activation and the accumulation of neophiles. By doing so, this reduces any damage to the epithelial fluid channel. At the same time, vitamin C can prevent vascular damage caused by the activation of these particular white blood cells, the neophiles. So far, the Chinese research has found that 85% of the 252 students treated experienced a reduction in symptoms at high doses of vitamin C, 1 gram per hour, at symptom onset for 6 hours, followed by 3 intakes of 1 gram per day. Among patients with sepsis and ARDS, acute respiratory distress syndrome, patients in the high-dose vitamin group did not show an improvement in prognosis or other clinical results. That being said, there is still some confusing factors in the existing research, and the conclusions are different and variable. Therefore, during the current SARI, severe acute respiratory infection epidemic, it is necessary to study the clinical reports on the efficiency and safety of vitamin C through randomized controlled studies for viral pneumonia. By September 30th, 2020, this research, carried out in China, will give official value through which scientific evidence for or against the effectiveness of this substance can be gained. Con: vitamin C doesn't cure COVID-19. In an article that appeared in the National Library of Medicine, National Institute of Health, Dr. William Simmons, clinical consultant pharmacist, wrote that data on these possible uses is often controversial and contradictory. Therefore, it is not entirely clear whether the benefit can be, at least partially, attributed to better nutrition. Overall, the regular use of vitamin C supplements shortens the duration of the common cold, but does not reduce the risk of contracting it, except in people subjected to severe physical stress. Ergo, marathon runners, skiers, or soldiers in subarctic conditions, where the incidence is reduced by half. The ingestion of vitamin C supplements after the onset of cold symptoms does not have proven benefits. It is probable that this antiviral effect is the reason why vitamin C has attracted interest as a possible treatment for COVID-19. Although some reports about the effects of drugs are convincing and provide what may appear to be evidence that a particular drug or therapy has a specific therapeutic or adverse effect, it is important not to be misled. It is fundamental to highlight that correlation is not causation. While it is tempting to believe in the anecdotal evidence that it can have real effects, proof of the efficiency of a drug can only be obtained through a double-blind, placebo-controlled study that is published in peer-reviewed scientific journals. Expert opinions. Dr. Michele Lagioia, the medical director of Humanitas in Rosano, Milan, claims that vitamin C neither cures nor prevents coronavirus infection. Vitamin C is a water-soluble vitamin, which our body is unable to accumulate and conserve, and which, therefore, must be consumed with food. It is involved in various metabolic reactions and the biosynthesis of amino acids, hormones, and collagen, and is known for its antioxidant effect. Vitamin C also contributes to the prevention of tumor growth, reinforces our immune system, and inhibits the synthesis of carcinogens, particularly in the stomach. Its assistance is also indispensable against free radicals. Its importance cannot be denied. However, its role in treating coronavirus is currently an unfounded rumor. Vitamin C does not cause harm, as long as it is not abused. The risk of fake news like this is that people may consume too much vitamin C, risking hypervitaminosis, and the consequent disorders of the kidneys, stomach, and digestive system in general. Moreover, it is good to remember that vitamin C has no therapeutic benefits in curing flu symptoms, and therefore cannot be of any help in the prevention or treatment of a cold. At most, it can shorten a flu episode, but care must be taken not to abuse it. Can vitamin C overdose cause problems? It is unlikely that a vitamin C overdose can cause problems, because the kidneys expel the excess, as vitamin C is water soluble. In other words, any excess that is consumed is eliminated with the urine. There are no deaths with an overdose of vitamin C as the registered cause. Still, there is proof that people who consume more than 2,000 milligrams a day can experience diarrhea, nausea, and may be more likely to develop kidney stones. Dr. Raffaella Cancello, of the Italian Outpatient Center for Oxalogic Obesity Arioso, with 9 offices in Italy between Lombardy and Piedmont, said, all reducing agents and antioxidants, including vitamin C, can also act as pro-oxidants when there are high levels of metal ions. In fact, vitamin C supplements are not recommended in people with high iron levels. If you are unsure about using a supplement, it is always best to consult your doctor before adding them to your daily diet. What to do in the meantime? Dozens of studies are currently being launched on new COVID-19 treatments due to the urgency of the pandemic. The WHO has just begun trials of the 4 most promising drugs on the market. In order to achieve a credible and positive result, it is necessary to have evidence that an officially administered treatment provides a significant advantage compared to current methods of treatment, which unfortunately are still little more than supporting treatments. As always, the most effective way to avoid the virus is still to wash your hands, avoid touching your eyes, nose, and mouth, and respecting the norms of physical distancing in crowded environments. As for us, we do not know whether vitamin C is effective or not for the treatment of COVID-19, but we know that it is an excellent antioxidant, and it is good for the skin, so we highly recommend it. Our vitamin C products have thousands of positive reviews on Amazon. You will find the link to our website and the Amazon showcase of our products below the video. Florence Organics products are organic, 100% Italian, and promote a lifestyle that respects natural resources and the planet that hosts us. Well, we're at the end of the video. Thanks for watching. Please subscribe to the channel to be notified about our upcoming videos. Below the video, you will find some interesting links to learn more about the topic. And you, what do you think? Do you take vitamin C when you feel weak? Your opinion is important. Let us know what you think in the comments. Bye!